So I want to look at another complication of osteoporosis. So we looked at osteoporosis, and from the definition of osteoporosis, of course, you know that what this is a complication of osteoporosis. So I said that osteoporosis is a reduction in the density of the bone. So it's just obvious for you to know that what if the bone is becoming softer, you can basically have fractures. You understand? So this is what is known as what osteoporosis-related fractures. So for osteoporosis-related fractures, we said that it's just basically you have weak bones because you have osteoporosis. So those bones easily fracture from something that normally your bones could have resisted, like forces. But because your bone is weak, you can just easily get fractures from normal forces. So osteoporosis reduces the bone density and strength, so it makes bones brittle and weak. So even normal falls or normal hitting your leg on some daily activities, that you can just cry and you go your way, you're having fractures. So the issues increase with age, and most commonly in female sex. There's family history, the person smokes, there's low calcium or vitamin D intake, and if the person is the type of person that practices sedentary lifestyle, they just stay in one place for a very long time. So what are the common signs? You have vertebral fractures, you have hip fractures, then wrist fractures. That's a Colles fracture most of the time. Okay, but for women, most of the times the hip. Okay, most of the times the hip. Okay, so consequences: you have a lot of pain, it could result into deformity. There's reduced mobility. There's increased risk of you having fractures later on. And because you know that when you fall, you have fractures, you are fearing to fall, you are depressed, you are isolated, you are like a baby in a glass. So also the bone mineral diagnosis, all this bone mineral density, X-rays and MRI, the clinical assessment tools for fractures, the fracture assessment tool. Okay, so you manage to use all those NSAIDs, gabapentin, opioids if necessary. Surgically we repair, the hip fractures. You can also brace or also do the vertebral plasty. Okay, so you also use medications like all those biphosphonate, adequate calcium and vitamin D intake. That's your supplementing, then weight bearing and muscle strengthening exercises. Then also prevents the person from falling, since you know that when they fall, they'll have issues coming up.